currently leads technical teams working in 15 states across India for WASH programming, notably to support the Swachh Bharat Mission. Then we have Mr. Divyang Waghela, who joined the Tata Trusts in 2008 and currently is working as head of Tata Water Mission, TWM, a WASH initiative of the trusts. Mr. Divyang is, after working with the Asian Development Bank, Mr. Waghela made a transition to the non-profit sector in 2004 and got involved in implementation of community-based decentralized WASH projects with Water and Sanitation Management Organization, WASMO, which is a semi-government organization in Gujarat. He also served as an executive director of a non-profit organization working in climate adaptation issues related to coastal ecology in Gujarat. So very interesting differences in background, but all extremely relevant. Then we have to my direct left, Mr. Raghava Neti, who is the Senior Infrastructure Specialist at the World Bank. Raghava works with the World Bank in its Water Global Practice in South Asia Division. He's a Senior Infrastructure Specialist with experience in urban development, rural and urban water and sanitation, and as well as natural disaster risk mitigation sectors. He's now leading the World Bank's largest sanitation program of US $1.5 billion to support, giving support to the national program of SBMG. So welcome to all of you. The way we will do this panel is that we have 2 rounds of questions. I'm hoping that you will try to limit yourself to no more than 5 minutes per round, because I've seen the energy in the audience and we want to leave them enough time to grill you. But also I want to encourage you, to interrogate each other. So if after we've had 1 round, you who are the experts on many of these issues, if you want to ask your colleagues on the panel something as well, let's have that as an opportunity. So it'll make it more alive. So the first issue I'd like each of you to tackle from your own organization's perspective is, and you've been here and you have seen some of the summaries of the studies, etc., of the research we're discussing today. So what do you think are the implications, the key implications and takeaways from this research for your organizations in terms of programming, in terms of policy, whichever angle you want to take. And let me start maybe all the way to the, no, I'll start, no, sorry. So we will start with Ms. Dutt, and then we'll mix and match after.
Thank you very much, Mari. And thank you, everybody. I think the morning was really, really interesting. It was incredibly exciting to see 4 different programs that were doing actually lots of similar things and yet lots of different things, and what we've learned from them. There are, I think, 3 big things that we're taking away. So there's several members of my team in the room as well, and we've just had a quick powwow to see, what does this mean for us? And I think there's 3 things really 3 questions that we're taking away. The first one is perhaps a small detail, but it's really thinking about, when you're thinking about programming and you're thinking about interventions, are you designing them thinking about your theory of change in its entirety? What I mean by that is, do you expect the action that somebody's going to take as a result of your programming stimulus to go all the way to the end of your theory of change? So are you expecting somebody to actually start using a toilet or consistently using a toilet, or does it stop somewhere in between? And that thought was triggered really by the use of pledges, because we use pledges so much in a lot of our programming. We've done this with health as well. And it's interesting to think about the fact that, to think about how pledges work. You could think about it as, I've taken a pledge, I've done my bit, and that's it. And is that then going far enough? So for us, one of the key questions was, what are we asking people to do through our interventions? And is it going far enough? The second thing that I wanted to pick up was from the intervention in Karnataka, where you saw that social status was something that really worked as a key driver. And of course, the flip side to that we've done in a lot of our work, particularly on urban sanitation more than rural sanitation, is the link to social disapproval. So they're two sides of the same coin. And it's interesting when you think about how the Swachh Bharat Mission has thought about social disapproval or social status and linked it to pride. And you think about how the Swachh Sarvekshan surveys are designed and how it's designed really to build competition and to get people to take collective action about the pride of their community or their city or whatever it is. And I think there's an interesting link there perhaps when we're starting to think about sustainable behavior. Is that a driver perhaps for us to explore? The third one is around risk perception. Now, we've spent so many years working on sanitation, and we've all kind of come to the same conclusion perhaps that risk perception is a really difficult thing to move, or a difficult driver to try and get behaviors to move. We wonder whether there's lessons to be learned from the world of HIV programming, where risk perception worked only when the definitions of risk were changed for the individual. So when it became about social stigma, when it became about losing work, that's when the use of condoms actually started to shift among men who were having high-risk sex. And it's linked again to, to sort of something that we've been thinking about more and more in other spaces, which is the theory of normative social behavior. This is Rajiv Rimal and Real. And wondering whether if we think about clustering behavior based on their attributes might actually help us think differently about what we need to focus on to really see significant change as we go forward. So those are sort of the three big takeaways for us.
And if I may, just one follow-up, and in what you are doing in your programming, sort of how are you addressing some of these issues?
So a lot of our programming, like I said, is focused much more on urban sanitation. We have just completed a long-format television program, so a TV drama show, really trying to get people to think about, in an urban mohalla or an urban neighborhood, what does collective action look like, and what can you drive with collective action when it comes to ensuring that people have the right kind of containment structures rather than superstructures, and preventing open discharge. So really focusing on insanitary toilet use. We're waiting for results. We're expecting them in October. Concurrent monitoring is showing us that there is a lot of engagement with some of the ideas that we've presented in the show. And we know that from global evidence around drama programming, we know that engagement is often the first step to actually starting to see people adopt ideas and practice them in their own lives. So we're hoping that we're going to see some changes there. We stepped away specifically from risk perception in that programming because we weren't sure how to do this. So maybe this is an opportunity for us to think about it differently going forward.
Excellent. Very, very fascinating. Now let me turn the same question to Mr. Divyang next.
I think the context in the first session, I think broadly quite diverse geographies. The whole all four studies looking at the different socioeconomic cultures, also the availability of water and all those things have been quite different. There are 2 points which I feel is quite common, which has actually come across. One thing is about capturing the aspiration of the community, which is more towards the positive elements, which was focusing on in terms of how the people would like. So smart toilet and Sundar Gharana, this other thing, reflecting on the aspiration of the communities. That's, I think, the very commonalities, although the diverse geography brought that element very strongly. And that seems, I think, the quite linked with the sustainability element going forward, because the latrine use and also the maintenance. So maintenance will look at the life cycle cost and the age of the toilet, which I think one of the member actually highlighted. So that way I see a very big connect between the what has been tested in few geographies, but actually linked with the futuristic questions which are going to come forward addressing the sanitation issue both in the rural context and maybe the semi-urban context also. I think not into urban space. Second point which I feel in terms of the impact is more because I think the intensity on the interpersonal communication more at the household level has actually converted positive results, which generally is a bit of a departure from the conventional Swachh Bharat Mission messaging or the behavioral change communication, which is broadly at the larger level at the national, state, or at the district, which actually sometimes doesn't reach to the the grassroots level. So the one negative thought was that because of the one of the presentations reflected because of the very some specific messaging which may not be a right can actually create a perception of the community differently. Now, if that correct messaging is not happening at the grassroots level, which I think at the individual level is very, very important through the interpersonal communication, which actually is very critical in nature where you try and reach out to there. It has a downside in terms of the investment per household is going to be high, and then will pose a question how you can scale it up the same model. And the third point, which I think, which I feel in terms of how you look at this behaviors more in terms of converting into the next generation issues, because what we feel the behavioral changes is a dynamic process. Okay, the information age is very fast, so people actually getting information, knowledge, and education. So the conventional behavioral change processes would not sustain. So need to look at how the more futuristic questions can be answered in design of the behavioral change elements, which can address more futuristic aspects rather than looking at the conventional issues which has already been addressed so far. Thanks.
And if you also, a similar question, if you could talk a bit to what your organization is doing in this area, and whether any of this sort of will make you change anything, or any of these thoughts will make you change anything in what you're doing.
Sure. I think in 2017, 16, 17, we started the sanitation program quite intensively in around 10 states. And I think we, that time, took a departure from the conventional CLTS model to look at more in terms of the positive nurture model. So one of the campaign we designed through some of the people who have been part of this actually studies also, we have done something called Samajhdar campaign, which is actually addressing the positive nurture. Okay, so the more progressive thoughts, sanitation is not naming and shaming, but it's actually having some kind of a pride to take it, and how we can actually become a progressive if you have a basic amenities. So that actually we tried in different geographies, but I think we got a one common element which actually connects the core of the behavioral change, and then we actually scaled it up in around 10 states quite successfully. That helped us in terms of thinking about this as a cross-cutting area which can be, applicant to other areas like nutrition or even health, which actually we are currently trying to shift that or maybe taking the learnings and bringing into the nutrition and health perspective. The second element, I think, which we tried in terms of, again, in partnership with one organization called One Drop Foundation, to look at how you use the social art in terms of, using the social local art to change the behavioral as a part of a process. And that we found has been very, very effective, cutting across the male, female, and also the children. So that way, I think the whole entertainment aspects can be converted into the behavioral change process, which was a low cost. Obviously, we need to look at the cost elements and how we can actually bring the low cost elements to scale it up. So these are the two examples which we found quite helpful and I think impactful in our programs and sanitation space.
Fascinating. I wouldn't be an evaluator if I didn't do one more follow-up to you on this one. Because I think we hear here, for example, some similar interventions that have been tried and that we presented on here. So, for example, some sort of local art. You had some performance in one of the researches. And we also had, there was very much this sort of the trying with the positive nudges, in the sense, the pride, and promoting the pride side of things as opposed to the shaming, etc. So some similar things. You said this was successful. I wonder whether you evaluated it.
Okay, so there were no very structured research evaluation has been taken up, but we have actually done some small impact assessment through internal evaluation teams. The success could be rates in two perspectives. Definitely, you need to look at some specific parameters and how this could actually be lead to it. We were working in a specific geographies. We were not working at in terms of states, in terms of whole state. We were covering kind of districts and some of the blocks in this. Now, when we tested in the 3 states, and we found these results in terms of the rewards, incentives, and the positive actually brings more people to invest. So one example I would say that in Gujarat, when we started doing it, we thought of actually only the sanitation is the one issue. But when we started about the whole this reward and incentive and the promoting the pride part, the women actually came forward and then said the bathroom is also one of the elements they would like to go because of the personal hygiene and other issues. The households, almost 80% households, the data what we have actually have started investing their own resources to build households apart from the toilets. And that was one of the a very, very positive outcome which we found in very initial stage of the interventions. And then we took the similar model across in 6 or 7 states.
Excellent. Very, very, very interesting. Whoops. Let me now turn to Raghava from the World Bank. Same question again to you.
Okay, thank you very much. So essentially the takeaway that I have from this is that I found that the general usage has increased across the board probably, and probably that would have happened because of a Swachh Bharat Mission intervention. And I find that because of the interventions that are done through these 3-4 studies, that has increased further. I'm happy about it. But then one is to see what is the relative impact, where is the difference that we are making, what is that which is making that difference, okay? So I found that despite all this, there seems to be some group of people who are probably tough nuts, who are going to be left out, okay? So in these evaluation, it may be possible to draw out what are the commonalities which can probably be picked up so that we can present to the government to take it up. Because in my view, in my experience, what happens is when the government does these kinds of behavior change interventions, it will be a kind of blanket approach that is followed. So at the same time, we may not be able to expect the government to go to this micro level and try to identify what is relevant in a particular context. So there has to be a bridge between what the government does and what is the outcome of these kinds of studies, how we can probably capture them and then make it relevant and make the government adapt those interventions. Okay. Usually there are 2 varieties of constraints when we want to enhance the toilet use. One is on the socio-cultural side. In most of the studies, those aspects have been identified. That relates to the mindset of the people. The other one is on the delivery side, delivery of the government program. Like say, water is not there, toilet is not functioning, finance is not going. All these are related to government delivery capacity or government governance capacity. In the program that we do in the World Bank, we try to develop the institutional capacities so that the government's machinery will be able to address them in an efficient manner. Okay, so the challenge that we are facing is how do we probably make a district administrator, for example, tailor the BCC approach to suit his context. Okay, that is where probably a commonality of recommendations from these, if they are given, that will be very useful. Okay, so the other thing is that in Mac's presentation, he had mentioned the transition from intervention, mindset change, and then the change of behavior. So in terms of that mindset change, how do we measure is a big issue. Probably, I think your experience you can compare and see how do we change the, how do we measure the mindset change of the people, okay? That is very important. As part of that, the other challenge that we have faced is also how do we check the behavior change? What kind of questions can we put in terms when we ask the community whether you use the toilet or not? There are a number of political economy factors or a local dynamic that will play in terms of people answering that question. Let's say a guy, a householder probably would not have received their funding, or he might be expecting more funding, though he would have received the funding. He might tend to say, oh, I have toilet, but I don't use. Or he may say the other way. So these are all the constraints which need to be understood. It's not that all the time whatever the community says is the correct one. So I think how do we prepare the system to be able to measure that? What is the experience of measuring toilet use? What kind of questions are being put? What can we learn from that? That is the another thing that I think we need to understand. Okay. In terms of what we are trying to learn from this and apply on the behavior change, we are helping the government to launch another study which is called as Swachh Sarvekhan Gramin, which happens now between 2019 and 20. So in that we are asking the government to check how the behavior change can be measured, what can, meaning what is the impact of the behavior change interventions, and then what can we learn from that. Probably that will help in the next version of behavior change communication that they adapt. Secondly, the bank's focus, World Bank's focus is fully on sustainability from the institutional capacity developing angle. So we are trying to focus on that. We are helping the government on their ODF sustainability campaign.
Excellent. So just a couple of also comments from, we with the research team, we're coming from 2 days of workshop, and I think a couple of the things you mentioned that, would be interesting to look further into. So for example, how does the behavior change work of the SBM compared to what we've been doing? It's one of the things we've been talking about that could be an interesting follow-up study. So we look, there are some further takeaways, and really interesting to hear your some ideas there. One question I had for you before I hand it over to Nicolas is, we keep talking about behavior change in rural Bihar or somewhere in the rural structures, but does the bank, for example, think about how to build in behavior change when you are strengthening government institutions, and what would that imply? Is that something that I know it's a tricky question, it is a hard one, but any thoughts on that?
Yeah, so that is in fact difficult thing to make it happen at the government level, because government has to adapt all these lessons and then maybe go to the village and address those constraints what we have identified. Okay, so the option that the government has is to have either a staff member on board, or to hire consultant individuals, or to hire some consultancy firms like probably 3AE and all to come and support. Okay, so the challenge is then how do we train, how do we build capacity, what kind of resources are there which can have that capacity, which can train. So I think there must be a partnership with institutions like yours, so which can probably translate this knowledge to the government sector.
Excellent. Let me hand over to Nicolas.
Sure, thanks. First point, behavior change is such a complex thing. It's really important to have a learning component. So I'm grateful that you're holding such forum and that you continue to do so, and thanks for the invitation. The findings from the study echo some of the study we had carried out globally or in India. For instance, the global evaluation on community-led sanitation covering 30 countries that we did in 2014, showing that the two main factors that contribute to the risk of relapse with communities going back to open defecation after having ended it are, one, the quality of the construction, and two, the lack of follow-up visits. These were the exact terms of the practitioners. And more recently in India, in 2017, we did the cost-benefit study showing an 85% usage rate. So it's quite similar to the findings. And then I just have two reports that just came from two districts about the use of child feces. Here our stats are a bit better than the one from the studies, like about 45% of child feces are handled safely. The point is, it's a difficult matter to tackle behavior change. And to echo a bit what the colleague from the World Bank said, the tension, I would say, are one in how do you, the tension between the blanket approach, which is necessary when you have an ambition such as the Swachh Bharat Mission to cover the country. And so you can, it's very difficult to plan realistically on a local level. And the necessity to have the creativity at the local level. So that's very difficult. It's also the difficulty to transform the learning we have, and there is a great learning in this room, into models, operational models on behavior change. We know a lot about that. There is interpersonal communication, there is edutainment, and then social and media campaigns. And we know about the messaging, but then what's the model in place to scale that up? And here we necessarily have to choose battle and square things, and we cannot have such a wide array of approaches which are scalable. And the second point, it's what is currently happening in India is really interesting. I guess you all know that for the past 12 months already, the government and the partners and the partners on this dais have been working on what comes next. It's been 12 months already, even more. And it's this open-defecation-free sustainability ODF plus agenda with several components on continuous behavior change. So beyond the discussions around the numbers, 85, 75, I guess from UNICEF's standpoint at least, what matters is there a real program to sustain, and there is a 10-year sanitation strategy that is in place? Is there money? Is there a monitoring framework? Is there accountability for sustainability? And from our knowledge, it's there because we've been working on it, so that's really important. And the interesting part of this second phase is that my understanding is that there will be a shift from state and district-driven approaches to Gram Panchayat. And there is money, there is knowledge, there is an intention of capacity development. The government is engaged in a campaign to train 750,000 elected representatives from GPs on sustainability. And this is where I believe, compared to district and sanitation, and district and states, we can have a much greater localized approach, understanding the broad concepts of behavior change in a simplified manner, but then applying it to the local context. So this helps me to see the glass half full compared to the glass half empty. Thank you.
Oops, excellent. I would like to invite the panel now to, if you have any questions to each other. This is part of what I wanted to, I mean, you're the experts on this, and I'm sure you had some things you wondered about.
Some to each other.
Yes.
To each other. I have. Okay. As part of the solution as well, we feel that be it for the hardware part, which is part of the problem for sustainability, or the behavior change part, how can we have a better use of the expertise? Because it's been 4 and 5 years that ODF is in every mouth. We have plenty of experts in the government, in NGOs, and in the private sector. And so how do we use that? How do we have a better use of the very dynamic? I'm always impressed about the dynamism of the private sector in India, finding solutions. You want creativity? Set the boundaries. So how do we have a better use of that? This is Golden Bar, and I'm looking at Tata Trust, being corporate, World Bank, having working a lot on those public-private partnerships. In one hand, what's the system to select, train them, license them, and mainly, how can we support the government to use their money to contract private operators, either for hardware and software, like communication agencies. The whole system in place for behavior change is this cadre of 500,000 Swachhagrahis. What's the system to track them, nurture them, replace those that have moved, and through the private operators? And in my knowledge also, at the district level, there is money, the government allocated, but when it comes to models for behavior change, they are looking for solutions. So how can we focus on that so that we can put in their hands a way to use that money and that mandate using the private sector as also part of the for behavior change or for rehabilitation? Sorry, I was a bit long.
Great question. So Tata and World Bank were put on the spot. Do you want to take a shot at it?
I represent the Tata Trust, so obviously not the corporate side of the things, but obviously I think we do work with the corporates, group companies, specifically looking at their expertise in some specific elements. One very direct connect which I feel in terms of the FMCG industry generally, when they do the the marketing to promote their products. Okay, now when we talk about the sustainability element of the the behavioral change and the sanitation, there have been a lot of elements which are broadly linked with the maintenance aspects. So there have been a very strong learnings in the private sector, okay, specifically in the FMCG industry, which have actually been reached out to the last mile connectivity through their strong marketing as well as the supply chain mechanism. These are the two very equally important things. Gradually, some of the group companies and specifically in the social space have started looking at the social entrepreneur as an interface to reach out and sustain the elements, and that not only to look at only the supply chain aspects, it's also look at the behavioral change. So one way the social enterprise is creating a demand, and then second side the social entrepreneurs can also fulfill those demands based on the requirements on the ground, and it works based on the demand and supply equation. I think there is a very strong need in terms of the rigor and intensity of the private sector understanding to create a genuine demand for the products or the services, and at the same time creating a cadre of professionals which I think are equipped and trained to deal with those kind of ground level requirement. So that way we are looking at the social entrepreneurship, and so one way is about the creating that, and second is about creating a kind of bringing a microfinance institution to provide the whole financing gap if you are looking at the self-sustainable model. Because I think one of the first question which in the morning saying what is the maybe the motivating factor to go for a toilet, and I think subsidy was the last one. So I think looking at the shift on bringing the private sector is very, very critical. So we need to look at both in terms of creating a cadre of professionals to cater to the service, and second side I think we need to bring the credit financing strongly to address the need of the sectors. That's what I feel based on our interaction with the group companies and working through private sector models.
Great. Raghavan, would you want to?
Yeah, I'm just thinking about the question as to how do we bring the expertise. We have been already coordinating. I think UNICEF has been very kind enough to give their premises for the regular coordination between the donors, development partners. So I think we need to continue that. And the ministry has developed a knowledge exchange platform, which is called as Swachh Sangraha portal. I think that is another opportunity where the knowledge which is evolving from a particular state can be used in the other state. Okay, that needs to be promoted. Hopefully, I think it gets used very much. From the World Bank side, what we are trying to do is we are trying to help the ministry to develop its own capacity to be able to manage that. So far, we have been managing that through a consultant. So we want to transfer that capacity to the ministry. So that is one part of it. Then the other part is probably we need to avoid replicating the same thing, being done by one partner and the other partner. One example is the solid liquid waste management. Because in our programs, we are trying to help the villages or say the states and districts to scale up the solid liquid waste management intervention. Because once the open-defecation free status is achieved, the next challenge is managing the solid liquid waste management. Okay, so on that, my reading is that when we speak to the governments, they say, okay, we don't have models, we don't have knowledge, okay, working models. So I think there is a need for us to develop or help the government to implement models, demonstrate. Because in India, I see that a particular state will say, okay, if I want to implement a particular thing, show me where it is working. You know? So that show me where it is working means somewhere it has to happen. Okay, so we need to identify some good leader who can implement such kind of model. So that is where this kind of leveraging private sector, the operation maintenance model, the locally relevant technologies, those things have to come together, converge, and then deliver in the form of working model.
I just want to, this may be a slight sort of cat among the pigeons question, but to my colleagues from UNICEF, Tata Trust and the World Bank, you know, we hear this so much that we need to bring in the private sector, and the private sector needs to play a bigger role in the private sector. And, you know, what's in it for the private sector? What are we offering them as a sector, as the development sector, and I'm taking the huge liberty of speaking on behalf of the government as well, but those of us who are responsible, if you like, by virtue of what we do for development outcomes, what is the promise that we have for the private sector? Maybe there is one, but it's just a question for us to consider.
Okay.
Incendiary
Well,
questions.
First, business opportunity. There is a big one. Using public money, there is a demand here, and we have done a lot of work at the district level to see what were the budgets for behavior change, how was this used. And I think it would really help the government to go through specialized agencies from the private sector to delegate that. And then it's structuring the work. How do we make sure that the payment goes against performances? Very simple example, fecal sludge management. You shouldn't pay someone at upstream level, the operator who desludges. It's only after safe disposal in the right place that he gets a payment. And there are very simple examples in India, across the world, that we can replicate. And then there is also a need, well, that's a bit different from your question, but we learn about behavior change, but we could see that the bottleneck is how to contract them. I mean, we are UN organization, we are heavy bureaucracies, but compared to many places in the government, we are the Hussein Bolt on delivering contracts. And in India, in the hands of the local administration, some contracts can take 6 months. So it's nothing to do with behavior change. But can we revisit that, use the research capacity, identify the bottleneck, and convince to make changes? So then it will help everybody. It's a better use of the money, because there was pressure, spend your money, so then you can see posters going all over the place. Is it really, and we know it's not what's the solution, it's more those Swachhagrahis, these door-to-door visits continuously that helps. So I'm digressing a bit from the private sector, but there is business opportunity to deliver the public service, one, and there is business opportunity for all the sanitation value chain, and it's huge. I mean, transforming poop into manure, and on the solid waste, because that's strong in the agenda, and I take the example of my country, the big companies, Veolia, Suez, they are what they are today thanks to the delegation to the corporates of a lot of the public services regulated by the government. And they had contracts for 80 years. Imagine a secured income for a company, and this is creating jobs, and it's allowing to grow. So that's what's at stake for them. And I mean, the size of the business in India, just to quote the figures put by the Toilet Board Coalition, as of today is in the range of $25 billion, and its potential is $64 billion. That's the private sector, but they won't come in if they don't see that they can tap into this and on a pragmatic, I mean, operational basis.
And tap in easily.
Easily, exactly, easily.
Does anybody else want to say anything, or should we move to the next? No? Yes, yeah?
It's important. So currently the private sector is there. But it's quite unorganized sector. It's not a very structured. Okay, so the honeysuckers has been actually in most of the peri-urban cities have been there, but they are not structured. So they are like, if there is a regulation, what Nicolas said, if there is a regulation and there is a good incentives for someone to look at the long-term gain, obviously the private sector will actually look at the ROI. Okay, so if there is a structural regulation, then definitely the private sector would be there. And obviously the segment on value chain, supply chain has been very high, as he mentioned, TBC, 32 billion is the currently the estimates on. But again, it's a fragmented sector. If you need to bring this fragmented sector in a streamline, then definitely there will be interest on that. There are some bits and pieces and some examples in Philippines, and I think Gates Foundation has done something in Vietnam. Those could be adopted, but there needs to be a very strong, administration rules in place.
Wonderful. So my second sort of general question to the panel, and I will let you, if you do not feel like answering it, any of you, then you know, whoever wants to answer it, but it's digging down into this issue of behavior change. You know, we talked about, you know, there's, especially in large policies, in national programs, etc. You know, it's very easy to say, you know, to build infrastructure, and it's kind of the same everywhere. You know, you can sort of, that's one of your components of your programs, build infrastructure. Behavior change, as we've seen and already been discussing, it very much needs to be tailored to local context. And building that sort of flexibility into a design of a program, you know, is more complicated. And building the incentives into your program that ensure that, you know, at the local level we respond to local contexts, is also sort of more complicated. One of the biggest sort of incentives to change behavior, but maybe not norms, but behaviors, is, you know, is incentives. So, for example, monetary incentives. When you do monitoring, if a payment or to a private enterprise is related to how many latrines built, well, they will build it whether there, you know, there's connection to water or not, whether there's demand or not, for example. You know how, you know, the indicator you put and you will pay somebody against is what they will basically, you know, do. And so, you know, so how do we sort of really think smartly about really getting to this issue, this hard issue of behavior change into programs, into policies, building in proper monitoring, building in, you know, process evaluations that ensure that what's being done on the ground is what we planned to be done. How do we ensure that we also know about the unintended effects in case they, you know, we're not sufficiently adapted to the local context? You know, so that also are some of the things that came out of the studies, that, you know, if shaming, for example, is not something that, you know, necessarily works well, and it's certainly not something we would want to promote. So any thoughts on this issue, of the hard issue of getting to behavior change in a sort of a localized way from any of your perspectives? And who wants to go first? Yeah.
So, in my experience, if we want the government to do everything in a very efficient manner, so probably there is a constraint for doing that because of so many factors. Like it could be like capacity, it could be the financing, etc. So I think, as Nicolas said, we need to partner with the local level resources, local level expertise. It could be like a good president of a Gram Panchayat, so who would have done wonderful things. I think we need to use that resource and then ask the government to partner with that, with such kind of resource. The other thing is, what I've seen is that exposure visits work very well. In our program, we have adapted such kind of thing. Like if a village did very well, we pitch the other village which is not moving with this village. So that has worked really wonderfully. So I think
competition is a good
yeah. So I think that needs to be promoted. Then in terms of evaluation of impact, I think it has to happen gradually. So the government did something, and there is a need now to help the government to evaluate such impact. In our programs, we have built in certain say environmental impact, etc., to understand what is the positive or negative impact that are happening because of these interventions, because it needs to be known. Otherwise, probably just like that, building and constructing toilet, if it is going ahead without understanding the negative impacts, it may create a problem. So that is one.
One of the great learning from the Swachh Bharat Mission is that for once we have a very strong evidence that sanitation brings votes. And That's very important. As we speak, there is a delegation from Ethiopia visiting India and learning from it, because they want to replicate that, and under the leadership of their head of government. A few months back, together with World Bank, WaterAid, and others, we received a huge delegation from Nigeria. The same, big federal states, and they're very much inspired, and they want to pitch ODF at the level of the head of state. So how does this answer your question? No, it's about the fact that sanitation brings votes, and this applies at the local level, at the PRIs, the elected representative at GP level. And so that's a proof, and that's a hope for the future. And now, how can we do it better? That's an incentive, I mean, at the GP level. But then we need, and that's the other point, as you said, you dislodge at the right place, you get the payment. You build the toilet, I see it, it's geotagged, you get the payment. With behavior change, how do we do that? I mean, and unfortunately, you cannot have a randomized control trial and seeing that there is adoption of the practice to make the payment, because the payment will come in 3 years' time, which is not feasible. So we need that community to think about some measurable, simple stuff. I'll name 1 or 2. One is the recall of a messaging through a direct thing, or a direct interaction. One, then the last time they heard something on radio. Then there are some proxy indicators for hand washing with soap, the availability of a dedicated place with water and soap. So we need to come with some proxy process indicators that would allow also to have a form of mobilization of the stakeholders, be it from the private sector or be it the women self-help groups or the Swachhagrahis, but that the reward for behavior change is paid according to the contract, and we can have an incentive there. So, and here we need a lot of collective thinking on what is measurable and boil it down to simple stuff so that it becomes operational.
So just to pick up, Nicolas, on what you said at the very outset, which is that sanitation brings votes, I think there's a huge insight in there, and I think that's something, one of the biggest challenges with any kind of communication is how do you make sure that it goes all the way down to the last mile? And it's not just a challenge in behavior change communication, it's a challenge that marketing, private sector companies have struggled with forever, and that's why they spend the kind of money they do on marketing, and they have the kind of enormous field teams that they do. But I wonder whether there's something for us to learn again from the way movements spread and how ownership can be ceded, and whether sanitation bringing votes is an opportunity to bring those two things, those two ideas together. Because if you look at new research that's now being published about how ideas are being spread and are taking root in communities, it's happening pretty independently, and it's happening with very, very organic ownership. So it's worth it to learn from that, I think, and to see how, what's the balance of control? Where do you push the pedal and where do you let go and say, right now, this is for somebody else to take on and deliver? I don't know that there are any answers, but it's worth asking the questions.
Just take one small clue. Currently, we do work with something with the Pani Foundation on water. Basically, it's working on just taking some examples on that, because what you ask in terms of how you can localize creativity and bringing flexibility in business design is most challenging things. One way we can actually look at the very strong knowledge in the Indian structure has been like civil society organization and community-based organizations has been very, very strong across India. I think in the whole discussion, I think we need to look at how we can, rather than reinventing the wheel, and how we can use the existing knowledge which is available and maybe strengthen and enhance those in the direction of using on the more decentralized behavioral change processes. So the larger goal could be common, but I think it needs to be more localized, decentralized. And the decentralized capacity enhancement is very, very critical, and I think one has to invest into those resources. That's what I feel. Coming to the example of this Pani Foundation's model, I think they've started this whole campaign on, the water cup. It's basically competition among the villagers to do a maximum work. But at the same time, the idea is that how we can look at the collectivization. So the capacity of the community, I think, has been created not on the technical aspects, but at the same time also trying to look at how those local champions and leaders could be created, okay? And what are the triggering factors or motives which are more powerful to bring them become an agent of change. They have done in more than 5,000 villages. In last 3 years, this program has been going on, and we have just completed a very very basic first of all psychosocial analysis. So I'm taking a liberty of it, just sharing that this selfless leadership becomes a very prominent factor about bringing a change among the communities. So if that ownership comes at the local level, I think there are higher chances that the sustainability of this change would be continued by those leadership and then created a more, the micro leaders in that ecosystem.
Some really excellent ideas coming out here, and everything from competition at the local level, and how do we have some indicators to further ensure that competition. We talked about how do we measure. How do we have measurable behavior change indicators that are actually tied to payments? There's ideas around about how ideas spread. So and learning from that, and then this idea of local champions, local agents of change. I mean, so some really concrete, interesting ideas coming from the panel.